Part of our principles include treating the root cause in our patients, treating the whole person, which basically means that we always use individualized medicine.
This is a much anticipated interview for which we received hundreds of questions. So a big thank you to Dr. Ashley Girard, a naturopathic doctor based in Ontario, Canada, who works with many chronic UTI patients as well as those with other chronic bladder conditions. Thank you so much for joining me.
Hi, Melissa. Thank you so much for having me here today. I've been really looking forward to speaking with your community and you about chronic UTI and other bladder conditions, and helping to raise awareness about what naturopathic doctors can do to help with this condition.
And we're really happy to have you. Before we jump into some of the detailed questions that we got, I'd love if you can provide some oversight into what a naturopathic doctor does, what the approach is, and how it differs to that of Western medicine.
Okay. All right. So naturopathic medicine is something that's practiced differently in different parts of the world. Basically, there is regulations in place that are dependent on the country, the province, the state that it's being practiced in. So it really, really depends. A naturopathic doctor, someone calling themselves that in one country may have a completely different scope of practice, completely different training behind them compared to another location. So I can mainly speak to Ontario. So here in Ontario, we have a very wide scope. We are considered doctors. We have a college that oversees the profession and keeps patients safe. They set our standards. They allow us to diagnose, run labs. We have additional training that we can choose to do in order to become prescribers, which allows us to do a limited list of prescribing, but things like bioidentical hormones, thyroid hormone, as well as certain vitamins and minerals that are considered a prescription. So here in Ontario, we have a great scope. We have good oversight, and we have a lot to offer patients. So that's the way it is here. So I encourage your patients always to look up by their area the credentials behind their naturopathic doctor. There are 6 schools in North America that graduate naturopaths and use a regulating body to make sure that their schooling is appropriate for your full-time program that is usually done after your undergraduate. So there's lots of testing and making sure that we're not just getting a weekend course type of thing.
That's good to know.
Yes, which is a bit of an issue in some places.
I can imagine.
Yeah, which makes it very confusing for patients, because someone will say, go see a naturopath, but then that naturopath may have only, like I said, done a few weekend courses. And where they are, that title is not regulated, so anybody can use it. So always look to that first. At the core of naturopathic medicine, we follow 6 different principles that are at the heart of how we choose to treat patients. Of course, there's first, do no harm. That's something that's shared with the conventional medical side, of course. But part of our principles include treating the root cause in our patients, treating the whole person, which basically means that we always use individualized medicine. I get a lot of questions from patients. Well, what's your protocol? And I always have to tell patients that no, that's not how a naturopathic doctor is going to approach your care. How I create a treatment plan for one patient is not going to be the same as another, because we are all unique individuals. And if we're not addressing the whole person, then we may miss a facet that is going to help them heal, right? Another principle that we follow is to use the healing power of nature. So we believe the body has that innate ability to heal. And if we use the right treatments, then we can harness that ability and enhance it and help patients go forward being healthier overall, as opposed to just palliating symptoms with a medication or even a nutraceutical supplement can also at times palliate. And then another principle that we follow is to prevent disease, right? If we, and this goes hand in hand with the last principle, which is doctor as teacher. If we teach our patients the fundamentals of how to live a healthy life, then, and how to take care of their bodies, then they will be able to prevent other diseases from starting as we go through life, right?
Mm-hmm.
So that's one of the core ways that we approach care. Another way that I talk with a lot of my patients about is, we call it the therapeutic order. And that it's a triangle pictured. I should have the diagram, but you can look it up. You can search the therapeutic order, and it's at the bottom of the pyramid. Is we try to establish those foundations for optimal health, diet, lifestyle, stress, thinking, feeling, how, getting patients to a healthier lifestyle. And then from there, we'll try to stimulate those healing mechanisms using our various therapies that we have, that we're trained in, to get the body to heal. Maybe it's missing some ingredient. And then sometimes we may have to go to a physical issue, a physical alignment of some sort. This is kind of where physios, chiropractors, osteopaths come into play. And then we may try to palliate if we're still not getting better with natural products. If that doesn't work, then pharmaceuticals, and then potentially high force interventions like surgical procedures. So we really believe in following that order. Sometimes we have to palliate symptoms a little bit more early, because it's not ethical to leave a patient in a situation where they're in pain while we wait for their body to start healing. But that goes more into the practice. And yeah, so that's how we approach care as naturopaths. And some of the key differences, which you can probably guess based on what I've described, is that we try to be more proactive as opposed to reactive. Here in Canada, we have a very reactive system. It's a free system, but it tends to be more reactive as opposed to establishing those foundations for optimal health. We also treat the patient like they're the expert of their own body, right? I don't know how many times I'm going to hear a patient say, my doctor said it's in my head. That breaks my heart. So that's not respecting a patient's innate knowledge about what's going on in their body. So that's something else that we talk a lot about throughout our education. We focus on quality of life versus life-saving medicine. And we focus on the physical, mental, emotional, and spiritual health of patients, as opposed to just that physical aspect. And we try to listen more than we talk.
Very important.
We do longer visits. Very important. Very important. Longer visits. I don't understand how we can provide really thorough medicine with a 10-minute visit here in Canada. It's, to me, just
impossible.
I spend lots of time with patients, and I just keep learning more facets about their condition that are useful to me and help me determine appropriate treatment plans for them. Yeah, so those are the main qualities that dictate how we decide to treat patients. And then, of course, we have nutritional medicine, lifestyle medicine, botanical medicine. We're trained in Chinese medicine and acupuncture. We even get some training in chiropractics and physiotherapy, hydrotherapy, homeopathy. And then other schools have some modality. We call those modalities. Some schools have different modalities. And then, of course, many practitioners go on to learn additional things like IV therapy, ozone therapy, like I mentioned, bioidentical hormones, bone therapy, prolotherapy. There's just so many different options out there for patients to explore with naturopaths, and depending on their individual training.
That probably makes this next question a bit hard to answer. We got a couple of questions around the safety of naturopathic approaches, but if there are so many modalities, how can you answer, or are you able to?
Well, overall, the profession practices very safely. As I spoke about earlier, you want to find a professional who's regulated, right? Because then there's a college to hold them accountable if they're doing anything that would put patients at risk. So that's the most important thing, right? Our regulating body reviews everything that we are allowed to be doing as a profession, and stipulates how that's to be done in a safe manner. ensuring patients have informed consent so that they
Mhm.
understand what they are, what the risks are for any therapy that they decide to take or do. But overall, we have a very safe profession compared to pharmaceuticals and surgical interventions. There's much lower risk in general. Some of the most common side effects that we see with some of the nutraceuticals is GI upset, diarrhea, maybe some dizziness. Some of the herbals can cause a Herxheimer reaction, which is when the body has a die-off reaction. It creates almost flu-like symptoms in a patient, and those do have to be done, monitored carefully. But most interventions are very, very well tolerated.
Okay, that's good to hear. Are there studies to support a number of these approaches in naturopathy?
There are, not necessarily from the way a naturopath might approach the patient with the individualized treatment plan, like I was describing. We have a few studies with that where they had 60 patients with heart disease, and they didn't even they weren't focused on the intervention that was used. They were focused on the fact that a naturopathic doctor did their intake and designed them an individualized treatment plan, and then they looked at the outcome to see if they were, what their 10-year heart attack risk was. And overall, they see in those studies that it is a good complement to conventional care. So we don't have a study like that for approaching urinary cases, but the same principles apply. So in terms of supplements and botanicals, nutraceuticals that are used often with urinary patients, there is lots of research out there to support their use.